Hi friends, I am Dr. Akshay Kumar Saxena. I am a consultant orthopedic and a spine surgeon at CK Birla Hospital in Punjabi Bagh. And today I am going to discuss about various kinds of arthritis with all of you, some bit of information, some bit of advice, and then what is a correct stage when a medical opinion should be sought. So what is arthritis? Now arthritis by our scientific definition is any patient who develops pain in the joints, and that pain is associated with inflammation. And what does inflammation mean? There is swelling, there may be some bit of effusion, there is limitation of movements. That exactly is what arthritis is all about. And when we talk about arthritis, there are actually various forms of arthritis. So one in which a certain patient is genetically predisposed to develop arthritis, what we now call as inflammatory arthritis. And the other form of arthritis is what is called as non-inflammatory arthritis, in which a patient is not predisposed, but due to the wear and tear of the cartilage of the joint on a daily basis, the patient starts developing pain over a period of time. So a brief about inflammatory arthritis. Now classically, inflammatory arthritis happens or starts or taking onset at a slightly younger age, and then there could be rheumatoid arthritis, there could be ankylosing spondylitis, and various other forms of inflammatory arthritis. And as I just mentioned, these patients are mostly predisposed genetically. What does that mean? That it's in their genes. So there is some locus of mutation or change which predisposes a particular patient to have these immune complex reactions, a lot of synovitis and swelling in the joint, and pain. Now this is, I would not say a serious, but yeah, this is a very important form of arthritis. Why? Because early detection of this form of arthritis is very important for correct formulation of treatment, for the correct path, and that the patient does not just keep on taking painkillers, and which may actually lead to a lot of joint destruction is what we normally see. So for inflammatory arthritis, if it is slightly early onset, if you're having a lot of pain and a lot of stiffness when you get up in the morning, if it is a bilateral, means both limbs are involved simultaneously as far as pain are concerned, and especially in females, if it's a small joint involvement like hand joints, then please consult your clinician, a rheumatologist or an orthopedic surgeon, because then you would be needing certain amount of tests, which are blood tests, to understand whether you may fall into one category or that category in which there could be a genetic locus of mutation. Now if that is the case, it's like if a patient is a case of inflammatory arthritis, then there are various forms of treatments, right? So if we start with a class called as disease modifying anti-rheumatoid drugs, then we have a judicious use of steroids, which we can do both intra-articular, that's inside the joint, and oral steroids. Lots of physiotherapy, calcium and vitamin D supplementation to keep your bones strong, because inflammatory arthritis leads to decrease in the bone density quite rapidly. And nowadays we have something which is called as biological therapy. So what exactly is that? For patients who are having a lot of severe symptoms, we have these injections which are now available, in which the symptoms can subside. It may not eventually get 100% treated, but the symptoms can subside drastically, and the patient can lead an almost near normal life. So the take-home message for inflammatory arthritis: early diagnosis, prompt treatment, and a healthy, active lifestyle. Okay. If you have any further questions or queries, do not hesitate to come to CK Birla Hospital. I am there almost on every single day, and if you have any other questions, also do not hesitate to post questions. So I'll be happy to answer them. Thank you so much.